Today, as I mentioned just now, I'm the Professor Dr. Adaikalam, the President for Malaysian Sleep Apnea Association, as well as the CEO of Alpha International Training and Consultancy, Sendirian Berat. Okay. As you can see, my handphone number is appearing on the screen right now, which is 012-327-5911. Okay, that's my number. And for those of you, if you have questions to ask me after the program, you can still reach me via my handphone number through WhatsApp or through SMS. Okay, so let's move on. Let me share a little bit about what I know about sleep. Okay, we move on from there. Okay, let's talk about why sleep matters. Kenapa tidur itu amat penting? So if you look at it now, a lot of emphasis is given on health. Okay, people are talking about the importance of health, the importance of looking good, and so forth. But if we go back to the basics, kalau kita lihat daripada basic, maksudnya bila Tuhan melahirkan manusia ni dalam dunia, Tuhan telah memastikan bahawa satu hari itu dibahagi kepada 3 bahagian. One day is divided into 3 segment. Okay, biasanya kita kena bekerja selama 8 jam. We should be working for 8 hours. Okay, and then we should be spending time with family for 8 hours. Bekerja selama 8 jam. Kita kena bersama dengan keluarga selama 8 jam dan kita kena tidur selama 8 jam. 8 hours of sleep. It's also important. So in one day of 24 hours, the segment should be 8 hours of sleep, 8 hours of time to spend with family, and 8 hours of time to spend at work. But are we doing this or not? Okay, are we really doing this or not? If you ask me, many Malaysians, if you talk about 8 out of 10 Malaysians, they do not really spend 8 hours of sleeping. Okay, so that is why it is important today for me to speak about why sleep matters and why sleep is important. Okay, for example, now a lot of people, even in my office, for example, they say that, doctor, I spend a lot of time exercising, and then I want to be fit, and all that. I went to, this gym, that gym, and so forth. So I always ask them this question. So how long do you spend time at a gym? Okay, at a gym. So usually an average person will spend probably about 30 to 45 minutes a day or at a gym. So is the exercise more important than sleep? Now we have to ask this question, is the exercise is more important compared to sleep or not? Because sleep is something you have to have it for 8 hours a day. But whereas exercise is only 30 to 45 minutes a day. So definitely sleep plays a very important role in our health. It is not to say that exercise is not important, it's equally important, but you do not have to spend so much of time. 30 minutes to 45 minutes of exercise, a brisk walk should be more than enough for a person. At the same time, of course, the food consumption also plays an important role. So it is all complementing each other, but obviously sleep matters the most actually in our life. Okay, let us look at people who have less sleep. For example, those who are sleeping for 5 hours or less per night, their mortality of having diseases as well as meeting with an accident is much more higher compared to the people who sleep a proper 8 hours of sleep. Okay, and if you look at in the US, 1 out of 5 accidents that happens on the road through motor vehicle is due to sleep deprivation. This is very, very important that we have to speak about sleep during this wellness month, so that emphasis will be given by all Malaysians on the importance of sleep. Okay, so if you ask me how many hours should you be sleeping as an adult, let us talk about an adult who is above 18 years of age. Regardless whether you are 95 years old, you should be sleeping between 7 to 9 hours. So in average is 8 hours. Okay, so you can't say that, hey, I'm already 80 years old, so I should be sleeping lesser hour. There's no such thing. Okay, but why is it that many people who become older always tend to complain that they can't sleep? Okay, there's several reasons, because I did some research on this, and I found out that as you grow older, there are a few things happens in your body. Number one, your melatonin production in your brain will be lesser. So when there's a less melatonin production, that is when you find that your sleeping pattern changes, it reduces. That automatically happens in your body as you grow older. But there's also other factors that also affects your sleep pattern when you grow older, such as body pain. You know, as you grow older, you start sakit sini, sakit sana, everywhere you sakit. So when you have body pain or inflammation in your body, then you start complaining about not sleeping well. Okay, so that could be one of the reason as well. And also as you grow older, the other issues that happens to our body is that we tend to have a lot of sickness, such as diabetes or high blood pressure, or we may have all the other medical problems, and we tend to consume medicine. When you start consuming medicine, your body hormone becomes imbalanced, and then that's when you start feeling that you can't sleep. Okay, so I had a very interesting conversation with our former Prime Minister, Tun Dr. Mahathir bin Mohamad. So he asked me this question, how come I only sleep for 4 hours and I feel okay? It is not you feeling okay, but at the same time, it is you can't sleep longer because of your body ache as well as the consumption of your medications and so forth. And it's very interesting to speak to the older generation, because when they were in school, or sorry, when they were in the medical profession, as well as when they did their medical studies, what we realized is that they don't study anything about sleep, because sleep was never an issue in the 1950s or 1960s. Sleep only became an issue in the 80s and above. So more and more people are having sleep-related problem in the upcoming years, you see. Dulu tak ada masalah tidur. Sekarang masalah tidur tu sudah muncul sebab permodenan. Permodenan, penggunaan banyak alat-alat elektronik seperti handphone, wifi, macam-macam kita pakai. Jadi ini semua akan mengganggu kualiti tidur kita. So ini yang mengakibatkan banyak masalah-masalah dalam kehidupan. Jadi kalau kita lihat dari segi simptom ataupun symptoms of sleep apnea, masalah berkaitan dengan tidur ini, kita boleh ringkaskan bahawa ada lebih kurang 96 jenis masalah tidur. Okay, there is about 96 different types of symptom of sleep apnea. Okay, but I'm not going to go through all the 96 because it may take 3 days and 2 nights for me to continue speaking about all the issues. But I'm going to share with you all some of the common ones, the common problem that we encounter as being a Malaysian. Okay, let me talk about snoring. Dalam bahasa Melayu, berdengkur. Berdengkur. Jadi, kenapa kita berdengkur? Okay, dan adakah berdengkur itu kepuasan tidur ataupun berdengkur itu adalah masalah tidur? Okay, many Malaysians, they take it as when you snore, you are having a good, satisfying sleep. Actually, it is not. Okay, let us talk about a car. When you buy a brand new car, does the car make any noise? No, it's very smooth. As time goes by, let's say about 5 years, you use the same car, or 6 years, you use the same car, and then you start having some sound coming out from your car. Sometimes you hear this noise like tang 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 tang, like that. And then what you do? Immediately you send your car for servicing, because you know there's something is not right in the car. Okay. Similarly, as a human being, let's talk about in a very layman language. Okay, that's why I'm giving you this example. Same goes to a human being. When you are young, you don't snore. You are sleeping silently. But as you grow older, there's some noise coming out from your system, which is called snoring or berdengkur. Okay. So when you have this problem, basically it is a sign that is the time for you to see people like us, people like me, or a group of specialists I will share with you later, that you need to see. So berdengkur is actually a masalah, satu masalah berkaitan dengan tidur, yang perlu diberi bantuan secara awal supaya dia tidak melarat, So it's important. So snoring is very common among Malaysians, but again, we talk about the loudness of snoring. Is where are you snoring very mildly, as the same level as you talk, or is it louder? So all these we will analyze and we will find out whether it's actually disturbing your sleep or not. The other thing is called choking or gasping sound. Dalam bahasa Melayunya orang panggil dia sebagai tersedak. Maksudnya masa tidur tu dia kadang-kadang macam ni. Dia batuk. Macam tu. Jadi ini adalah tanda tersedak. Tersedak itu sebenarnya satu bahaya. Okay, tersedak ni sebenarnya adalah berhenti pernafasan. You stop breathing. Where a sleep apnea episode will take place. So it's very important to stay focused on what I'm saying. Choking or gasping sound during sleep is a very dangerous situation. So that is why you can see a lot of people die in the sleep. But when they die, sorry to say, most of the doctors do not go to the root cause of the problem. So what they will do is, what you need is just a death certificate. So they will say this person had a heart attack or this person had some problem. But if you go into a deep study about the root cause of the problem, the root cause could be because of snoring or choking or gasping for sound, which actually affected the person to have an heart attack and die. Okay, so I'm just giving you some example. And drowsiness, maksudnya rasa macam pening, tak berapa rasa sedap, bangun pagi tengok muka suami pening, tengok bos lagi pening. Ini semua adalah masalah berkaitan dengan tidur. Kalau bangun pagi, if you woke up in the morning and if you feel pening or if you feel headache in the morning when you wake up, that is already a sign of you having a major sleep problem, which has to be corrected as soon as possible. Okay, some people, especially the young people today, I notice, when you wake them up in the morning, they will tell the mother or the father, Mama, give me 5 minutes. We wake me up another 5 minutes time. Or give me 2 minutes, or give me 30 seconds, or give me 1 second, and then you wake me up again. That is also a sign of sleep deprivation. That means your body is saying that you have not enough of sleep. Okay? But your mind is saying that you have to go to work. You better wake up. But you are still requesting for allowance to be able to take another few seconds or few minutes of sleep. So these are all some of the signs of symptoms of sleep apnea or symptoms of sleep disorder. Okay, tiredness. A lot of people complain that I don't know, like I come to work, I feel very tired, lethargic. I don't know why. I slept well, last night, but still I have the body, very feeling tired and all that. Tiredness, if you are often feeling tired, something is not right in your body. That could be, again, related to sleep matters. Sore throat, common, problem that we see people having very often getting sore throat, sakit tekak, dry mouth. Dry mouth ni kadang-kadang kita kata dalam bahasa Melayu bahawa kita rasa macam kering mulut, kering, tak rasa sedap. Kadang-kadang rasa-rasa sedikit macam pahit pun ada. Jadi rasa-rasa pahit ataupun rasa-rasa seperti kering mulut ni adalah petanda bahawa seseorang tu menghadapi masalah tidur dan kadang-kadang boleh diakibatkan oleh hormon di dalam badan yang tidak balance. Non-balance hormone in the body that causes you to feel dry mouth and also very bitter mouth and stuff like that. As I said just now, unrefreshing sleep is a very common thing, that when you wake up in the morning, you don't feel enough sleep or enough rest. That's all a sign which you can find it. Okay, difficult concentrating at workplace. If you notice, a lot of people nowadays, they have this forgetfulness. Ayo, saya sudah lupa lah. Ini sudah lupa, itu sudah lupa. Cuma gaji saja tak ada lupa. Yang lain semua lupa. Maksudnya, dia menghadapi masalah, it's already starting to building up on memory loss as well as forgetting things. Okay, when you start forgetting things, now itself, probably another 10, 15 years, you may have Alzheimer. So you must understand that how serious is this kind of problems if you don't treat it immediately. Okay, and then we have daytime sleepiness or fatigue. Fatigue is tiredness and so forth. Silent pauses in breathing, I've explained. Memory loss, I've explained. Decrease in sexual desire. You see, another important thing you must understand. Of course, I presume that most of you are adult here. You see, sex life. Okay, you have to have a good amount of oxygen in your body in order for you to perform a good sex life. But majority of the people do not have this. That's why first it will affect the mood. Mood has got to do with sleep as well. You don't have mood. Tak ada mood lah mau pergi kerja, tak ada mood nak buat ni, tak ada mood. So you see your spouse also, you don't have a mood. All because of the start setting up due to, could be one of the reason, could be sleep related problems. So as you can see here, the quantity, the quality, and the consistency sleep is very important. Jadi dalam sesuatu masa bila kita tidur itu, bilangan jam yang kita tidur amat penting, quality tidur amat penting, dan konsisten tidur amat penting. Ketiga-tiga inilah yang menentukan seseorang itu mendapatkan tidur yang cukup atau tidak. Okay? Jadi kalau kita lihat gambar di bawah sini, if you see the pictures at the below here, what can 8 hours of sleep can make you look like, and what a 6 hours of sleep can make you look like. So you can see, kalau seseorang tu tidur 8 jam, muka dia nampak lebih ceria. Lebih ceria dibandingkan dengan orang yang sama kalau dia tidur 6 jam saja, muka dia tak nampak ceria lagi. Jadi perubahan masa dalam tidur itu akan mengakibatkan kita juga cepat tua. I think nobody wants here to be growing old fast. So this is sleep is also an anti-aging or reverse aging process. So it's important that you need to give a lot of emphasis on sleep. Okay. So some of the symptoms, I can't go through all the symptoms today. Probably if I get another chance to speak, I will share with you more symptoms. There's only 96 different types of symptoms of sleep apnea. Let us look at health-related issues about sleep. Almost all the problems that you encounter today, the kind of sickness, it can be because of one root cause, which is sleep apnea. For example, let me talk about the common one. Yang paling biasa kita dapati among Malaysian, yang orang-orang Malaysia yang selalu kita nampak, dia ada hypertension ataupun tekanan darah tinggi. Tekanan darah tinggi ni kadang-kadang bila kita pergi ke dekat doktor, doktor akan check dan dia akan beritahu, dia akan pasang itu hypertension machine, lepas tu dia cakap dia check dulu. Lepas tu dia kata darah tinggi encik tinggi. Jadi encik kena jaga pemakanan, kena mulakan exercise, kena mulakan dengan beberapa exercise yang ringan supaya kita dapat kawal. Dan biasanya doktor akan beritahu dalam seminggu lagi datang balik sebab kita kena monitor. Biasanya doktor dia kena monitor 3 kali. For 3 times they need to monitor your hypertension, and then after which they will decide what is the next course of action. In most cases, I notice, I'm not blaming any doctors, but I'm just talking it very generally. Doctors are doing a great job. But at the same time, the doctors also do not check what is the root cause of the problem at times. So sometimes on the 3rd visit, they will say that you have to start with medication. So when you start medication, the medication might be a lifelong sentence for you. That means you have to continuously take the medicine for the rest of your life. Maksudnya sampai ke kubur kita kena bawa ubat tu. Jadi sebelum masuk kubur pun kalau boleh makan satu dulu baru masuk kubur. Baru kita punya pressure okey. Jadi ini adalah masalah-masalah yang kita akan hadapi kalau kita bergantung kepada ubat-ubatan. Tapi kalau kita lihat, could be the hypertension cause, you get hypertension due to sleep related problem. Contohnya kalau nak cuba malam ni kalau saudara-saudari nak balik rumah, jangan tidur malam ni. Jangan tidur. Besok pun kalau boleh jangan tidur. 2 malam. Malam Jumaat dengan malam besok. Jangan tidur langsung. Lepas tu hari Sabtu pergi jumpa doktor kesayangan anda. The doctor that you love him very much, go and see him, ask him to take doctor, take my high blood pressure and see. You will see a increase in your high blood pressure. Definitely there will be an increase in your high blood pressure. So just a 1 day or 2 days of no proper sleep can cause an increase in hypertension. So that is what an hypertension, a sleep related, no quality sleep can affect your hypertension. In fact, there studies has been done that people who do not sleep between 11 to 17 days, they will die. Death is just like that. By not sleeping for 11 continuous days, or up to 70, depending on your body immune system. So it's very important sleep to emphasize. I just showed you an example of hypertension, how an hypertension can be affected by sleep. Okay. The other important thing that I need to stress here is about obesity. Obesity. In Malaysia, I think we are one of the highest nation around Southeast Asia or maybe in Asia to have a very high level of obese in this country. And obesity is also related to sleep. Tidur yang tidak cukup ataupun tidur yang tidak berkualiti juga menghasilkan kita untuk menjadi obese. Walaupun kita jaga makan, kita exercise hari-hari, badan kita tak turun disebabkan tidur yang tidak berkualiti. Jadi tidur ni penting untuk mengekalkan berat badan. So you can see, this is the second thing I want to talk about. The third thing, drowsiness, I think you know. Drowsiness, you know. Fatigue, you know. Diabetes. Diabetes ni kita pernah buat satu kajian. We have done a study in Japan. A lady who did not sleep for 8 days, I think. If I'm not wrong, yes, around 8 days. She has actually got a type 2 diabetes after that. The type 2 diabetes is a very common diabetes that you can get due to one of the reason can be sleep disorder or did not have quality sleep. So there was studies has been done and it has been proven that this Japanese lady who slept only 4 hours a day for about 8 to 10 consecutive days and she got type 2 diabetes. You see, so easy to get diabetes. So sometimes you minum teh kosong, kopi kosong, tak cukup. Kalau tidur tidak dijaga. Minum kopi kosong, teh kosong tak menjaminkan bahawa kita punya diabetes kita tak dapat. Kita boleh dapat diabetes kerana kita tak menjaga tidur. Jadi important in terms of diabetes. Motor vehicular accident due to sleep, I will come back to it later because I'm going to talk about it later. Job impairment is because of your job performance is not good. Due to sleep, I will come back to that later. Arrhythmia is your heartbeat. Your heartbeat should be something like lap dup, lap dup, lap dup. But yours is lap dup dup dup, lap dup dup dup, like that. And then you can get a heart attack during your sleep due to no proper sleep. Yeah. And then heart attack, you know, I don't have to talk about it. Headache, is a sign of also sleep apnea related problems, especially when you wake up in the morning and if you have headache in the morning, that's a very clear sign of you having a sleep problem. Then stroke, you know, lungs hypertension, similar to, you know, hypertension, but that is happening in the lungs and all that. Dementia, memory loss, depression. Okay. In the year of 2020, once COVID-19 has come into you know, our life, we can see that a lot more people are having depression. And one of the cause of their depression is, of course, the weariness that they have. How am I going to pay my house loan? How am I going to pay my car loan? How am I going to make my living? And so forth, which actually affects their sleep. The sleep is the cause of major depressions. Okay, so you can see how important is sleep per se. Cancer, cancer. It again, sleep comes back to your immune system. Your immune system. For you to have a good immune, you need to have good sleep. Okay. In fact, one of the article which came out during COVID-19, they said that by having a good sleep, a quality sleep, you can actually avoid from COVID-19 as well, because it's an immune system. Because if you do not sleep well, your body will will have inflammation. Inflammation is another good example of you getting cancer. Your body becomes acidic due to lack of sleep. Your stomach start growling for no reason. And then all these are signs that can lead into cancer. So very important that sleep has to be given importance. And of course, next, without failing, is the importance which we are talking about. Mati pucuk dalam bahasa Melayu. Mati pucuk. Ini macam saya dah kata tadi, tidur yang tidak cukup, yang tidak mengakibatkan oksigen, peredaran oksigen dalam badan yang cukup, akan mengakibatkan masalah mati pucuk ataupun impotence. Mula-mula dia akan effect mood. Kita tak ada mood. Tengok ni pun tak ada mood, tengok itu pun tak ada mood. Lepas tu lama-lama dia akan effect kita punya semua organ-organ dalam badan. Ini secara ringkas. This is in brief about the importance of sleep in order to ensure that you do not fall into this category of problems. Many problems can be avoided by having good sleep. Okay, just before I go into effect on productivity, I think I need to also share with you all about the number of hours that you need to sleep. Okay, as I mentioned that just now, you should be sleeping between 7 to 9 hours. 8 hours is average, but if you can sleep 9 hours, is even better. So I have actually, I did my studies in Holland. So when I was there, I noticed that the people there, they sleep in average about 8.5 hours per day. Okay, and if you look at in the world map, they are the best people who have good sleep. Okay, and if you look at people who are about 80, 85 years old, they still look young in Holland. Okay, because they get good sleep and good rest. Of course, they also cycle a lot. They exercise in the sense that daily routine, they go by bicycle and all that. So it really helps. So 8 hours of sleep is good. 9 hours of sleep is excellent, but don't spend too much of time sleeping like a like a sleeping beauty. So 9 hours is the maximum you should be sleeping. You should not be sleeping 10, 11 hours because that will turn your body to be into a different state of mode, which is not good. You become lazy, you become, lethargic and so forth. Okay. Having said that, during these 8 hours, actually, you will go through 5 process in sleep, 5 process. But obviously, 5 is the medical. In medical, they say 5 process, but in a bahasa pasar or in a layman language, we'll say 3 process. That is, you go through light sleep, and then you go through deep sleep, then you go through rapid eye movement sleep. This 3 portion of sleep is very important. So for example, during a night, you should get about 3 to 4 hours of deep sleep. But very sad to say that when we do a test or when we do diagnostic among the people, rarely I find people who have got 3 to 4 hours of deep sleep. Most of them, they get only light sleep. Light sleep, tidur-tidur ayam. Tidur-tidur ayam. Maksudnya dia tidak masuk ke tidur yang nyenyak. Tidur-tidur ayam saja. Jadi tidur nyenyak ni penting selama 3 jam dalam satu malam. Dalam satu malam juga, in one night also, you must get rapid eye movement sleep. This rapid eye movement sleep must be about 90 minutes. It comes around 90 minutes. Rapid eye movement sleep is the sleep that you can see sometimes your eyeball is moving. Okay, I'm sure you can see my eyeball is moving. So the eyeball is moving, but you might be thinking that the person is actually listening to what you are talking. Actually, it can't. But basically, it is the time when you are dreaming and your body will go into a total paralyzed situation. Total paralyzed situation. So rapid eye movement is when you dream, and the dream comes in 5 episodes actually. It comes in 5 episodes. It doesn't come in 1 episode. It's like a drama minggu ini, you will come in 5 episodes. So first episode, maybe it comes as you sleep around 11 o'clock at night or something. Then you'll have a very light dream, and then it'll go on into a deep dream and different dreams and all that until the end. So you'll get 5 episodes of dreams. That is why I need to tell you one thing. You cannot tell me that, doctor, can I sleep 4 hours now? Another 4 hours I continue later in the evening. The dream cannot be dividing, I give you 2 dreams now, another 3 dreams I give you later. No such thing. So that is why you have to continuously sleep for 8 hours at least to get a complete body rest. Okay, that is a proportion of the sleep. That's why I'm saying the 8 hours of sleep is important. But obviously, as you grow older, some of you might complain that I can't sleep. Like I said just now, Tun sleeps for 4 hours, Tun Dr. Mahadi. So that doesn't mean that 4 hours, probably he gets quality sleep. And probably because as he aging, things like that, it's a different story. But you must understand that not everybody can cope up as good as another person. For example, you cannot be, you say Usain Bolt, there's only one Usain Bolt in this world. There's no 2 Usain Bolt, you see. Certain people are given certain capability of being well or being able to accept that lesser sleeping hours. but not all. Majority have problems on sleep. Okay, let us look at in terms of performance of people at workplace. Okay, you look at it. Look at this slide, please. Okay, as you can see, how sleep deprivation affects a productivity of a country or an economy of a country. A good example is Japan. Okay, lack of sleep costs Japan's economy billion every year. Last year, if I'm not wrong, they lost about 35.4 billion USD in terms of productivity due to sleep deprivation. As you know, Japanese are very smart. They do studies on how sleep affects the productivity. And if you look at it down here, you can see this is American companies lost about 63.2 billion a year in productivity. So in the US, as you know, maybe you might know or might not know, there's about 18 million Americans who are having sleep-related problems. There's a lot of sleep clinics there, but there's also a lot of people who are having sleep-related problems. Okay, so this is in terms of productivity as well as how total cost in USA, Australia, and UK put together in terms of absenteeism and presenteeism. There's a lot of this was done by PricewaterhouseCoopers, a study on well-being index, WBI, well-being index, which shows that by you absent to work, the three countries put together, they lose USD 150 billion. Whereas presentism, datang kerja tapi duduk depan komputer macam kerja tapi macam dia macam ikan sepat duduk dalam air. Duduk depan komputer tapi tak gerak-gerak sikit saja tapi benda kerja tak habis. Ini adalah presentism. Maksudnya datang kerja tapi tidak ada productivity. 10 kali ganda dibandingkan dengan absenteeism. Sometimes it is better for you not to come to work. Then you go to work, you are present, but there's no results. So these are the things that is happening in the world that I would like to show. Okay, talking about accidents. Okay, this is my view that in Malaysia, there's a lot of accidents are happening. And one area that the government didn't give an emphasis is about sleep. Okay, they always will talk about, pemanduan berhema, maksudnya defensive driving, send them for defensive driving, send them for medical tests, send for this and send for that. But why not? The government take the lead to do a sleep study and sleep diagnostic, because many years ago, I think about 2012, there was a study done during that time. I think it was Yang Berhormat Dato' Seri Liao Tiong Lai was the Minister of Transport. He did a small study. He took 100 bus drivers, and these 100 bus drivers has to go through a sleep study, and they found out that 45% of the bus drivers has got obstructive sleep apnea. Okay, this study was done by Myros. Okay, Myros. Okay, what is obstructive sleep apnea? Is obstruction. That means when you sleep, you snore, or your breathing passage is not good. So because of that, many bus drivers, as they drive, they either have a micro sleep or their reflection time is slow. You see, sleep to driving, I would say about 3 to 4 major factors that affects your driving. Number one, you can fall asleep while you are driving. That is micro sleep, they call it. Sometimes you are looking, you are driving, your eyes is open, but your mind is shut down. So you go and bang the car, then only you realize, oh my God, I've already met with an accident. That's a simple example of micro sleep. It can be also happening when your eyes is closed and you sleep off and you meet with an accident. The second part of it is about reflection. Okay, reflection time. Okay, reflection time, there was a study done by University of Nottingham in the UK, where they selected some Malaysians, some Chinese from China, from India, from Philippines, many other countries. And what the professor did was he took a thing and he just threw it to a Malaysian. And you know what happened? The Malaysian, instead of avoiding it, what he did was he hid it. He did a hiding. The reason is because his reflection time is so bad. Okay, so generally, I'm not trying to say Malaysians are bad or Malaysians' reflections are bad. But generally, Malaysian people have got a very poor reflection time. Okay, this is also a cause of accident. When you are driving, when suddenly a guy puts a brake in the front driver puts a brake, you should be avoiding the accident, but instead you go and bang the car. So reflection time is another issue. Okay, third issue is when you don't have a good sleep, it's going to affect in terms of your performance of driving. Okay, a person with high blood pressure and a person without an high blood pressure, I'm very sure a person without high blood pressure will be able to drive much more better than a person who has got high blood pressure. So these are some of the things that I can tell you that actually affects our driving performance. So sleep is very, very important in order for us to ensure that we don't meet with an accident, or also a way to reduce accident in this country. It can be accident at workplace, or it can be accident during our commuting to work and back and from work. Okay. Okay, let us move on to the next slide. Jadi kita sekarang di slide seterusnya, di mana kita nak bercakap tentang bagaimana kita nak betulkan masalah tidur. Jadi kita sudah tahu kita ada masalah tidur. Okay? Kalau tak tahu, senang saja. Malam ni bila pergi tidur di bilik, katakan suami tidur sebelah, isteri sebelah, beritahu suami, okay, you jangan tidur malam ni, tengok saja macam mana saya tidur. Adakah saya berdengkur ataupun saya keep turning left and right. If they keep turning and left and right, it's called the leg syndrome. That means you are not having a peaceful sleep. You keep moving left, keep moving right. That is also a sleep-related problem called the leg syndrome. Okay, so now all these problems you know already. So how you want to correct it? Okay, 3 simple steps which I'm going to share with you quite quickly. Number 1, diagnostic. Kena buat diagnostic, diagnostic test. Sebenarnya tidur ni adalah bukan penyakit. Okay, jadi kalau kata, okay, contohnya saya beritahu sini. In hospital, dalam bahasa Melayu adalah rumah sakit. Okay, rumah sakit adalah untuk orang sakit. Jadi sekarang contohnya kalau saudara-saudari ada masalah tidur, adakah saudari-saudari sakit? Sebenarnya tidak. Jadi tidak semestinya perlu dirawat di hospital. Tidak semestinya perlu dirawat di hospital. Sebab itu diagnostik ini kita boleh jalankan di rumah ataupun di hotel, at your convenience. So not necessary that when you have a sleep related problem, you must be treated in a hospital, because sleep is not a medical problem, but it can lead to medical problems. Okay. Okay. Number 2, participant will have to use the device as instructed, or the patient will have to use the device as instructed when they go to sleep. Okay. Nowadays we have very simple devices that can actually help you, okay, to be able to check your sleep problems. Okay. So it can be so easy, and all the collection of your data can be uploaded into iCloud. You know, nowadays technology. So we can retrieve the report and we can go through. Okay, that's the diagnostic. Okay, so I think there are a few questions that you all are asking, but I will come back to that shortly. Let me just finish a few more slides, then I'll be ready to answer all your questions. Yeah. Okay, then in terms of consultation, you see, when it comes to consultation, this is important that you must understand. Through our association, we have a group of specialists. Okay, a group of specialists, not just one specialist, but we have 6 different types of specialists. Okay, ENT, ear, nose and throat specialist, psychiatrist. Sleep can be related to psychology effect as well. So psychiatrists, we have neurologists, we have sleep specialists, people like me, dentists, and respiratory specialists. So these 6 specialists will be looking at your report. And once the report has been seen, then we come to the part of solution. Just to share with you, as you know that since I am the president for Persatuan Sleep Apnea Malaysia, I have actually set up a sleep recovery center called Recovery Hub, which is located in Plaza Damas, Sri Hartamas. Probably this is the one and only sleep recovery center in the country, okay? Which is basically if you're having stress or having trouble to sleep like insomnia, or if you are having sleep related problem, we can help you with modern sleep therapy as well as traditional sleep therapy. Okay, there's modern and the traditional way of correcting the sleep problems. Okay, let's move on. I will come back to the questions because at the moment I'm still on the screen, but I will definitely answer your questions as soon as I complete a few more slides. Yeah. Okay. Okay. Of course, the benefit of quality sleep, you want to improve your health or healthy lifestyle, reduce your medical expenses, reduce accidents in the workplace and committing accidents, as well as you can increase your long-term productivity and perform better at workplace. Okay. Okay. These are some of the modern therapy that we have in our sleep recovery center. This is called the cryotherapy chamber for improving sleep. It has been proven as well as it has been tested to show that people who have got sleep related problems may or will be able to improve their sleep by going through this chamber. This chamber is a cold shock, which is for 3 minutes only. You go into a very cold environment for 3 minutes, which will actually improve your sleep as well as it cures jet lag. You see, sleep, as I said, can be also due to pain, having body pain, muscle pain, and so forth. So we also cover that pain relief and muscle healing. Weight loss. I think many of you would like to lose weight, same like me. Always, I'm very concerned about my weight. Do you know that you can burn 800 calories in 3 minutes by using cryotherapy chamber? So this is one way to manage your weight, because weight has got a very close relationship with sleep. Okay, if you don't manage your weight, if your BMI is above 28 or 30, you will definitely snore. Okay, so to cut off all this, you have to lose your weight. And of course, this treatment also helps into many other things, such as reducing inflammation, preventing dementia, um, preventing cancer, not treating. Yeah, I'm sorry, it's written as treating. It's not treating, it's preventing cancer from happening, because cancer cell will not be able to live in a very sudden cold shock. So sudden cold shock actually will shrink them. So that is why going into cryotherapy chamber once or twice in a week is a very good idea, to also ensure that you keep away from cancer. Of course, reduces anxiety, depression, and so forth, as you can see here. There's a lot of things that it helps. It's not just helping you to improve sleep, but it also helps you to cure other problems that you have. So here in our sleep recovery center, we also have another thing called the dream pod for improving sleep. This is an interesting place. I usually spend a lot of my free time floating in this thing. As you can see here, I'll be floating. Why do I float? Because I want to improve the absorption of natural magnesium into my body. So today our body is so chemically attacked that sometimes when we eat, fruits like banana, or we eat spinach, which has got a high level of magnesium, but the body could not absorb it. The reason is because our body is not, inclined to this one. So that is why we put you into this kind of treatment to ensure that you can go through all this improvement. Okay. Okay. Basically, it's like a swimming pool, a smaller size, which contains about 500 kg of Epsom salt. So it's quite similar to Dead Sea. And then when you lie down, no matter what's your weight, you'll be floating. So you'll be sleeping on the water. Most of the people, they be able to sleep, and the treatment is only for about an hour. So the other one, cryotherapy, is only for 3 minutes, 3 minutes therapy, whereas DreamPod is an hour treatment. Of course, we also have other form of improvement to increase your sleep ability, such as normal tech compression therapy, which helps blood circulation, reduces pain and soreness, decreases muscle tension, inflammation, and so forth. Okay. Also helps diabetes patient. So basically, it's a pulse technology, patent pulse massage technology, which helps you to ensure that your blood flow on your legs are better. It also cures many people who have got varicose vein. Okay, so this is the other thing we have. Infrared sauna also is a way of you to improve your sleep and have a good relaxation, and this detoxify your body and helps you to lose weight and so forth. So this has also studies which has shown that infrared sauna helps people, okay? Because usually by using infrared sauna in the evening, just prior to bedtime, helps you to lull you into some of the best sleep that you can get for that night. Okay, okay. So of course, localized cryotherapy, that is to ensure that your body pain as well as um, stimulate collagen production to ensure that it also reduces inflammation and so forth. So all these treatments are available at our sleep recovery center, which you can visit by appointment to get the services to improve. Of course, there's also other solutions. You must understand the natural therapy, which can be some exercises to improve your sleep apnea, exercises for insomniacs, breathing exercise, and so forth. But the only problem with natural therapy is that, as you know, many of us, we are not disciplined enough to do it every day. So we tend to, give the last priority for certain therapies. Okay. Of course, on top of that, we have dental device, which is also popular right now. Dental device, which is actually a kind of like a device that will be placed inside to ensure it can help you to breathe better when you sleep. But this is more suitable for people who have got mild sleep disorder, or moderate sleep disorder. And of course, the other machines which are quite popular was CPAP and BiPAP. Many people tend to buy it, but they don't use it so often because sometimes it's not so conducive for them. So there are many ways of helping you to solve. But we are talking about non-invasive way. Non-invasive way meaning you are not going to go for an operation, which is not going to help you much. Okay, but a lot of doctors do advise you for operation to remove your tissues, and throw it away. But tissues can grow again, and it can make the problems severe. Okay. So sleep disorder, just quite quickly, give me another 2 minutes. I'm going to finish right now, and then I will answer all your questions. Just to also show you that this is not a issue of Malaysia. This is a world issue. There is world sleep conferences that I attend. We have people coming from various parts of the world complaining about sleep problems. This is a good example. You can see Singapore. Singapore National University of Singapore has done a study. 1/3 of the people in Singapore is having obstructive sleep apnea. Huh? Uh, then we can see Indonesia, a lot of them having insomnia, can't sleep. Okay. You can see China, 60 million of Chinese people suffering from sleep disorder. You can see Thailand, 20% of Thai suffers from insomnia, not enough of sleep. Korean, most sleep deprived in Asia Pacific. 93% of Indians are sleep deprived. One of the reasons is because they are very technology inclined. They use a lot of computer gadgets and stuff like that, which actually affects their sleep. Philippines, you name it, Australia, UK, USA, and so forth. So this is kind of like a continuous problem, and it is one of the biggest health-related problems in the world right now. People who are having sleep-related problems. Okay, just before I answer your questions, some of your questions, I would like to mention that I'm accessible through my Facebook, which is Luis Adaikalam. You can also visit our YouTube, Malaysian Sleep Apnea Association YouTube. You can also visit our website where a lot of informations are being shared, and also a lot of things that you can get to know about the importance of sleep, the articles that I've written, and so forth. Okay, so I think it's time now for me to answer some of your questions. Let me stop sharing. Okay, let's see whether there's any questions that need to be answered under the chat column. I can't see any questions right now. Is there any questions that you all would like to ask me through the chat? Maybe I will try my best to answer as much as I can. But as I told you that for sleep, there's 6 specialists. It's not just me alone being the sleep specialist, but there are also people, certain things might fall under the jurisdiction of a psychologist. Some might fall under the jurisdiction of ENT. Some might fall under the jurisdiction of dentists. So I may not be able to answer all your questions, but I will try my best. Okay, so the chat is open now. I'm just waiting. If anyone wants to ask me questions, you may ask. Just feel free. There's nothing wrong, nothing, is right. We just want to know. We want to just share what we know. So please do ask me questions. Okay, I think I've seen some questions here because it's not on the chat, but it's in the handphone here. Okay, oh, there's quite a number here. Okay, let me see. Slept 11:03 last night, deep sleep 3 hours. Is that good or bad? Okay, so I think there's someone here by the name of Shital Bagal who asked me this question. Okay, you see, you must have a combination of light sleep, deep sleep, and rapid eye movement sleep. So by just sleeping 3 hours, you cannot say that you would have got a deep sleep. How do you know that you have got a deep sleep? Unless if I do a diagnostic, that's the only way that we will know. So I think I've answered, but you can always ask me if you have any questions to ask via my WhatsApp or even through my emails and so forth. Okay, let's look at another question here. Miss Camelia, I think. Can one take melatonin on regular basis to help sleeping? Okay, Camelia, just to answer your question, there's a lot of what do you call that, supplements out there, out there in the market. But I would suggest that anything that you are going to consume, be careful, because definitely all medicines has got side effect, and side effect might take place in your body. So that is why when I'm here, I'm trying to talk about non-invasive as well as non-consumption based solution. Okay, it's all external, not something to consume internal. Any chemical that goes into your mouth, into your stomach, definitely there will be some side effect. Yeah. Okay, that's the other thing. Okay, next one is Hannah Halim. How can we get back on track after a few nights of bad sleep habit? Find myself having to take a few days to recover, as in now being sleepy, as in not being sleepy. Okay, that means when you lose sleep for about 3 or 4 days continuously, it's definitely going to affect the pattern of sleep. You say sleep is a pattern, so you need to sleep on the same time every day and wake up on the same time, in regardless whether it's a public holiday or not. So it's a lot of it has a lot to do with discipline, it has a lot to do with discipline. But sometimes I understand you can't avoid it, you can't avoid it, but try your best to keep the same pattern. That means same time of sleep, sleeping at say about 10 at night, waking up at 6 in the morning, sleeping at 10 at night, waking up 6 in the morning, regardless whether it's a public holiday or a normal working day. Okay. So that I think should have answered your question. I'm waiting for more questions if there is. Okay, there's someone who has sent me through chat. I think it will be good if you can send me through the chat, which is in the page. Okay. Okay, I think very good. So far, I think Anna has asked question, but as you know, you can still be in touch with me to ask me more questions. You have my mobile number, you have my Facebook address. What more? Everything is accessible. You can't get it, you just type my name into Google. I'm sure you'll be able to find me. Okay, so that's it for now. I think like to catch up with you all again very soon, probably on other topics as well. Okay, so I would like to end the session for today, and I would like to thank AMSPA, Association of Malaysian Spas, to organize this event. I hope whatever I've shared will be useful, even though I didn't go in depth, but you can still be in touch with me to get more information. Okay, thank you very much and have a great day. Thank you.